Hi, I'm Dr. Thomas Pierkowski. I run a mobile GP practice in the Pretoria East area, and I do house calls for my patients, and I see a lot of very elderly patients. I think most of my patients are above the age of 80, and some terminally ill patients. And a question I get often asked is, Doctor, what do I do when this person here finally passes away? Like, what are the steps I must take? What do I do? And there's not much good information on the internet, so I thought I'll take all my knowledge and just create this presentation, just giving you easy steps to take if you're looking after someone who passes away at home. What do you do once they've passed away? So when someone passes away in a hospital, a lot of the admin and paperwork is taken care of by the hospital. But if you are looking after someone who's very elderly or terminally ill at home, when they pass away, then you as the family will have to take care of some of the admin and arrange to have some of the paperwork done from your side in order to complete all the legal requirements are necessary to have a death certificate and to close this particular chapter. So we're going to just go through all the steps required. So when someone has passed away, the first requirement is that a healthcare professional has to confirm that the person has actually passed away. In other words, we need someone to certify the death. And please note that certifying a death and a death certificate, they are not the same things. Although they sound similar, they are two completely different things. Certifying a death merely means that a healthcare professional agrees with you that this person has passed away, whereas a death certificate is a formal piece of paper issued by Home Affairs confirming that a citizen or a person has passed away in the Republic. But they are two completely different things. But the first thing you need is for someone to certify the death. And by far in Pretoria, the easiest, quickest, and most convenient way to do this is to call an ambulance. You simply call your preferred ambulance service and tell them that you need a paramedic to confirm a death for you. And the paramedics will come and check for a pulse and for breathing and for any signs of violence or any signs of a crime. There's no reason to suspect a crime, and there's no pulse, and there's no breathing, and there's no electrical activity of the heart. Then the paramedic will then issue a certification of death. And again, that's not the same thing as a death certificate. That's not the same thing as a cause of death. It's purely a piece of paper saying that this person has passed away. It has no more information than that. And if you're using a private ambulance service, you'll usually have to pay immediately. The ambulances usually have a card machine available if you want to pay by card. And once payment has been done, then the paramedic will leave the certification of death with the family, and then you can go on to the next step, or even do the next step while you're waiting for the ambulance. The next step is to call the Undertaker, and you can do this while you're waiting for the ambulance or once the paramedic is done. Ideally, you should have already chosen an Undertaker before your relative or family member has passed away. The reason being that even if you're expecting the person to pass away, it can still be an emotional shock, and it can still be difficult to think straight when a person has passed away. So if you've already chosen an undertaker and written it down somewhere on a piece of paper, then instead of having to think about it, you can just make your phone call. So the undertaker will basically come to your home, and if the paramedic has issued a certification of death form, then the undertaker will take the body to their mortuary. An undertaker will not take a body, in Pretoria at least, they will not take a body unless someone has certified that the person is deceased. So that is usually done by paramedics in the Pretoria area. Alright, so once the undertaker has taken the body to the mortuary, the next step is to find a medical doctor who's willing to fill in the notification of death form, the cause of death form, and if there's going to be a cremation, there will be the cremation form. Note that at this point we still don't have anything that is called a death certificate. So when you call the doctor, you're not asking them for the death certificate, you're asking them for the notification of death, the cause of death, and the cremation form. And it's better to contact the patient's regular GP, someone who knows the patient and can fill in the forms honestly and clearly, because you need to state clearly what is the cause of death on the form, because old age is not a legally recognized cause of death in South Africa, and for someone who's not the patient's usual doctor, it can be difficult to thumbsuck a cause of death if this is someone that you don't know at all. And this is also one of the problems of people. You have these elderly people that have never been to the doctor. They never go to the doctor. They maybe saw a doctor last 10 years ago and then they pass away. And now there's no doctor who recently saw them who can give an honest cause of death. Now, most of the undertakers do have relationships with doctors, with GPs who are willing to fill in these forms. These doctors will usually charge a fee that you as a family will have to pay. And technically this is often illegal, especially with the cremation forms, because these forms often have a section where you have to state as a doctor that you knew this person, you examined them before they died, or you examined them after they died. And these doctors often don't really care. They just fill in the forms regardless of whether the fact is true or not that they saw the patient or they knew the patient. So technically it's illegal, but it seems to be unpoliced. So it seems to happen that if you don't have a doctor, the undertakers will usually find someone who can fill in that form. But if you have a doctor available to fill in the forms and to do it in a legal and correct manner, then you can request the doctor to fill it in, or alternatively ask the undertaker to contact the doctor directly. Now, unfortunately, Home Affairs has made it much more difficult for doctors to get the required papers to fill in, because all these forms, the notification of death form, the cause of death form, has to be taken from Home Affairs. And it is a mission to get it from Home Affairs. I spent 2 hours at Home Affairs to get these forms for my practice, and a lot of GPs are just refusing to spend that time to go and fetch it from Home Affairs, because the other rule is that you have to go fetch it in person as a doctor. So many GPs are basically refusing to go fetch these forms. You might find that your usual GP is not going to be useful for you because they don't even have the forms anyway to fill in. But you can ask your doctor beforehand if they'll be able to fill in these forms. Ideally, you want the doctor to be involved before the person has passed away. And really, if you're struggling, then the undertakers will usually have some options on the table, but there will usually be a fee involved in that. I personally, I fill in the notification of death, the cause of death, and the cremation forms free of charge for all of my former patients. So if you call me to see your elderly relative or your terminally ill relative with a house call from my practice, then once I have seen that patient and you have paid all the fees and everything's up to date, then that patient is my patient, and if they pass away, then as part of my service, all these forms that are required, I will fill in free of charge. So you can just contact me or ask the undertaker to contact me, and we will arrange the completion of the forms from that point on. So you see there's quite a bit of paperwork involved when someone passes away. But once all those forms are filled in, the undertaker will then take those forms and the deceased's ID, and they will usually go with a family member to Home Affairs, and at Home Affairs you will finally get the actual death certificate. So all these forms are required as legal requirements for the issuing of a death certificate from Home Affairs. So when I do a house call for a family and I can see the patient's very elderly or is terminally ill, I usually recommend to the family to start preparing for this person's passing away. And my recommendations as a doctor are to pick an ambulance service to call and write that number down so that when the person passes away, you're not trying to think through the emotional shock. You just call the number that you've already written down, and you tell them you need someone to confirm that the person has died. Choose an Undertaker service, preferably before the person has passed away, because there are quite a few Undertaker services in Pretoria, and it can be quite confusing to decide which one to choose. So rather do all that sort of mental hard work before the person has passed away, so you don't have to think about it while you're still in emotional shock. And then choose a doctor, and preferably this doctor should be someone who has all the necessary forms and can fill them in and can be 100% legally compliant, and this doctor should see the patient before they die to be 100% legally compliant with all the forms. If you're not sure which doctor to use, please ask your Undertaker for a recommendation. Ask them which doctor they recommend to fill in the forms, because you don't have a doctor available. And the Undertakers in Pretoria usually have relationships with certain doctors. And then remember to budget. Dying is not cheap in South Africa. The ambulance service, the Undertaker, and the doctor usually all have their own fees that they will charge. And as I mentioned earlier, I personally, for my patients, I do not charge fees for filling in all the required forms. If all the accounts are paid for, then I happily fill in all those forms free of charge. So if you don't know which doctor to use, you're welcome to call me to arrange a house call, and I can see the patient before they pass away, and then you know that all those forms will be sorted out once the patient has passed away. Okay, thank you for watching, and I hope that was useful. I've had many patients ask me, or rather many families ask me, what are they going to do once a person has passed away, in terms of what are the next steps to follow and what are the legal requirements and forms that have to be completed. So this is a summary of all the advice I give to families that contact me for a house call, and I hope it is useful to you as well. If you have any questions regarding this presentation, feel free to contact me on my email. If you want to arrange a house call, you're also welcome to email me or phone me on my cell phone number 072-211-4520. Please note, I don't do emergency house calls. I do house calls only by appointment and during office hours. But if it doesn't need an ambulance, if it's not an emergency, then feel free to call me to arrange a house call. You're also welcome to visit my website for more information. That's www.docthomas.co.za. Thank you.